It's becoming, in some cases, a life and death or really a critical element in the delivery of care.
This is John Medved, the CEO of OurCrowd, and you're joining us again for our continuing series of Tech on the Front Line. We're being joined today by Dedi, who is the CEO of Tyto Care. So they're staying close to patients by enabling remote diagnosis as well as care of patients both in hospitals and at home in isolation. You're being deployed, I know, at Sheba Hospital in Israel, and actually, I think several other hospitals. How many corona patients are now using Tyto, in your opinion?
So we started in Sheba, as you just said, right after the cruise ship from Japan. The Israeli patient came to Israel, and we were since deployed in few departments at Sheba for the corona-based and in the urgent care. We then moved to be deployed today in Israel in 16 hospitals.
In 16 hospitals already.
We deployed it in their corona departments. We're also working. There's a hotel that was transformed to be like a remote hospital for corona patients, and we're also deployed there. So we've seen hundreds of patients today in Israel were examined with Tyto so far. Beyond Israel, we are doing some nice initial work, both in the US. US a little bit is behind the curve. And in the last week or so, we are deploying specifically for Corona in 4 of our biggest accounts in the US. This situation with the COVID-19, basically, there are 2 main elements. One, you really want clinicians and professionals to stay away as much as you can from sick people or people that are currently in quarantine, and let them be diagnosed remotely, whether they are in a clinic, a hospital, a hotel, and so forth, or whether they are at home. So this is one element from the clinician side. The other element is really there's a huge load today on the medical services. You know, clinics, ER, urgent care are all swamped with the work. People are trying to avoid it if possible. Health organization wants people to stay at home if they don't need urgent to come. So this is where Tyto can really allow this interaction to happen remotely. That people now see that it's way beyond a convenience issue or, you know, saving cost as it was from the get-go. Now it's becoming, in some cases, a life and death or really a critical element in the delivery of care.
My understanding, talking to certain doctors who've used it, they said that the images that you provide inside the ear, down the throat, or the quality of your heart or lung measurement is really unprecedented. That it's just high quality data. How do you manage to do that, and how do you allow a patient to stick something in his ear safely?
Tyto was designed for consumer usage, so it is a consumer kit of like 5 different devices that are performing 8 or 9 exams. Close to 80 health organizations out there being used in a professional way. So clinicians are using it with remote visiting nurses, in school-based telehealth. So you do need a high quality, all the algorithms and the way we treat the sensors and we interact with them, the optics and all of that to make sure that we provide high quality data. On the consumer side, the main barrier, it's not really around the sensors or the device itself. It's much more on the software and the algorithm side. How can you, like you just said, how can a lay user, a mother at home or a father, examine their kids or their cells or a family member safely and accurately? Meaning, how can a consumer close the loop with itself without any clinician in the room to really capture good images of the throat, the tonsils, the uvula, in the ear. It's the eardrum.
How do you manage to do that?
So we've developed multiple machine learning based algorithms and tracking real-time sound and video to give the user guidance and navigation in real time. We have very unique and proprietary capabilities to give the user feedback in real time from the smartphone that they are moving to the right location.
Almost like an automated landing system, which basically says, keep on, oh, don't go there, and it tells you what to do.
Giving you real-time guidance, voice and image-wise on the video that tells you go right, go left, in, out, stop here, it's too much. You capture the right data. We're also doing that in a sound-based analysis. So we verify that we are capturing lung sounds and heart sounds from the right location. And in the post-processing algorithms in our cloud, we're validating also the quality of the data. So this is the first phase. So clinicians are getting high quality data. This is what we do today. In addition, we are adding, as we speak, and we are releasing very soon to the market, few capabilities around analysis of the data. Beyond just capturing high quality information, we are also validating whether things are wrong or correct in a really comprehensive way for a clinician to diagnose a patient remotely, either in an online session like we're doing between us right now, or asynchronously by sharing data with the clinician for later on diagnosis. So,
can you make this stuff fast enough?
Tyto is tripling our manufacturing right now as we speak. We're built for mass production. We did it before, but we're now expanding, rapidly expanding that capability. We are feeling very comfortable that we are, keeping up with the demand.
Especially in today's environment where we simply don't have enough clinicians. Will the AI be able to help you give a quick analysis?
Yeah. So for basics stuff, for example, I'll give you a few examples that we are now can support. So lung wheezes, we are working on lung crackles. We already have capability to do tonsillitis analysis, so swollen tonsils, redness of the throat, things like that that can show a high probability for Streps A or for lung disease or lung dysfunctioning. So we're doing that today, and we are always doing it like you just said, like a decision support, AI-based decision support for the clinician on the images or on the sound. We are working with the FDA right now to regulate that in a very high level of safety.
And can viewers who are watching us now in the US still find this and buy it at Best Buy?
Yeah, so today currently are almost out of stock. They will now need to wait probably 60 days, the maximum, to get it. But we are replenishing Best Buy. We're getting a lot of orders also from them and from other partners in the US. And again, very soon you will have enough inventory.
We are very proud of you, Dedi, and another great example of tech on the front lines.